Is there anything that I'm aware of that would help someone who had a lot of dental anxiety or a phobia of coming to the dentist? Absolutely. There are a lot of people who have come to our office with a lot of fears about the dentist and we're able to overcome them. So, some of the things that I've seen. First of all, make sure that you talk about it, that you let the team know that you're working with that, hey, I have dental phobia. I'm really scared of this stuff. And I think that people hesitate to do that because it seems annoying, and it's not. Very, very helpful. Definitely tell people if you're scared of something, then we can be careful and not say the wrong thing or do things that will bother you and make you concerned. And we're happy that you told us so that we can be a little more cautious around it, and then we can talk to you about it. Then the next thing would be knowing what to expect. If you're going to do any procedure, ask questions. There are a lot of people who just are helped knowing what's going to come next and what's going to happen. And fortunately, none of it's going to be that severe. It's nothing that you need to be afraid to know about. It's all very, very normal because you do always get good results from these treatments. So it's not something that you need to be afraid to know what the steps are. The next thing to consider is trying to find different methods to relax. Some of the ones I've seen that have worked for people is bringing headphones in. Bring their own headphones, then they wear their headphones and they listen to whatever music they like. But in our office, we have TVs on the ceiling that play very distracting shows. We have the stress balls that help you focus on something else, or even a blanket for comfort. And any one of those we're happy to offer anytime. The other option is to be sedated, use some sort of medication, nitrous gas, laughing gas, use a sedation that will help you completely forget the procedure. If it was something that you couldn't overcome it, sometimes you need to be sedated. That's fine. The other thing to consider is making sure that you remember how important these procedures are, or remember how important the exams are. Imagine you don't get these things checked on, how much worse it becomes. And that would be the final thing I would say is take things a little step at a time. If you're afraid of it, I would start sooner rather than later so that you can start with just an exam, start with the cleaning, and do things small steps at a time until you're overcoming your fear bit by bit. And of course, met lots of patients. One man in particular that I'm thinking of, he had been so concerned that he didn't come in until it was a huge problem. He was afraid that he'd have a big problem, and eventually it became a big problem. So in his case, we're able to take care of those issues with some challenges, right? But we were able to talk to him. He told us how afraid he was, and we talked to him about it. We worked through it, and the final result was great. And then fast forward to now, he's able to do things just fine in the dental office. He realized, I need to come in, doctor, I need to be here at exams, every exam, and only catch it when it's very, very little. And the good news is I can't think of anything little that's come up either. He's just making sure it gets checked on, and he's aware of it now. So that's my advice from what I've seen treating patients and helping a lot of patients with anxiety overcome it. If you haven't seen one of these videos before, I'm Dr. Eck. I'm a comprehensively trained general dentist. And if you like the video and you think you know someone who would benefit from it, please feel free to share, and I hope you have a great day. Thank you.